All right. Hopefully you can all see my PowerPoint today. I was updating this until kind of the last minute. It has been a very busy and changing 2 weeks, as I'm sure you all know. So hopefully we can get you as much current information as possible, so we know it's just continuously changing. So as usual, just a reminder that this meeting is for school and health department staff. It will be placed, both the slides and the recording, on our website within the next few days. But for the sake of time and allowing questions to be asked, we ask anyone not with the school or health department to drop off the call. Make sure any needed information is shared with your school staff so that they have what they need to help out with this. First thing, I'm sure that everyone has questions about. On the 27th of December, the CDC announced via a very brief press release some major changes in isolation and quarantine guidelines for the general public. Most of us learned about this on the news, so it was very much a surprise. A couple days later, they did have a webinar for local public health and explained that a big reason for this was to help with the workforce, because so many people in the U.S. have been out ill or in quarantine that it really needed to shorten things to help get people back to work, to keep things functioning. They admitted that there really was not a whole lot of new evidence to support the safety of this, but just, again, trying to get people back to work in the safest way that they could. At that time, and kind of still, but they didn't have any specifics worked out for special populations other than healthcare workers. They had released that information on the 23rd. But they did say they were working on them as quickly as possible, and they did include schools and institutes of higher education, which are colleges and universities. There were a lot of questions, some that they weren't really able to answer at that time, but they did stress the importance that masking on days 5 through 10 were very important, because people can still be contagious. So again, it's not that they had shocking new information showing that people stop being contagious after 5 days, or that you stop incubating the virus after 5 days of exposure. They just wanted to provide easier ways for us to function. So a couple of nights ago, kind of after the work day, so basically yesterday, we learned about some new updated guidance that they did post to their website. And I put the page there explaining the background behind their changes, and basically like an FAQ. And they also did update the general public isolation and quarantine page. And they stated that their rationale was that given the large number of cases the U.S. is seeing due to Omicron, and that we're seeing more influenza cases and other illnesses, that their recommendations reflect the societal impact and latest science on disease severity and when and how long a person is maximally infectious. So basically, Omicron doesn't seem to cause as severe of illness, and our workforce can't function if they're home on isolation and quarantine. So getting people back sooner and trying to do it in the safest way. So largely an economic decision, but still, not necessarily a bad decision. They did present some evidence that predates Omicron, that the risk of spreading COVID was highest starting 2 to 3 days before symptoms and until 8 days after symptoms. But again, that was pre-Omicron. And they did discuss in their details the importance of masking in the guidelines that they had presented, how important that masking component is, stating that some modeling from the UK showed that a third of people stay contagious after the 5th day. It wasn't really clear if that was Omicron data or pre-Omicron data. But again, they did discuss that Omicron seems to be less severe, that we're all mentally just frazzled from this, and that really only about a quarter or a third of people actually finish a full 10-day isolation anyways. And so really a lot of us just see this as the CDC's way of making a step towards trying to get more back to a normal. So trying to find ways that we can better live with COVID. So other things that they do better fully describe in that document is that you need to continue to wear a mask throughout that full 10 days and limit contact with people in your household for 10 days. So again, it's not that after 5 days, you're scot-free. You're still potentially contagious. They recommend that you avoid contact with people that are immunocompromised or at risk for severe disease until at least 10 days after you're either exposed or infected. You should avoid nursing homes or other high-risk settings until after 10 days. You should try to delay travel. They also mention that you should not go places where you can't wear a mask, like restaurants, bars, or certain gyms for a full 10 days. And you should avoid being around other people in situations where you cannot use a mask, like eating at home or work. Despite those last two comments, they do have a brief statement in that further guidance saying that the general population recommendations for quarantine and isolation do apply to the K through 12 settings, but they have not made any updated changes to their K through 12 guidelines to really give specifics. So for example, when it says you shouldn't eat around others because you're unmasked for 10 days, well, how is that going to play out in schools? How should we handle sports? Those kinds of things. We really don't know what their recommendation would be. The CDC did just announce around 8 o'clock last night that they are going to hold a call today with us at 3:45 to try to explain things further. I have no idea if it's going to address these kinds of questions or not, but I will be on that call. We also had a call with the state health department yesterday. We did send out a message yesterday to give you some updates on that. They asked to have an opportunity to update guidance for the state before we kind of gave the green light to schools to go ahead with the CDC general population guidance. But they said it would be done by today, and we haven't heard anything yet, which, it is what it is. And I'm going to go over the guidelines here in more detail in a minute, but just before starting that, there are people where this does not apply to. So again, masking is extremely important for this to work. So anyone who's unable, as they say it, but I add in, anyone who's not willing to wear a mask, this new guidance would not apply. So that would be people under 2 years of age, anyone who might have a mask waiver, again, anyone who will not wear a mask should not be allowed to follow this shortened recommendations to as much as you can, to your ability of your powers. We know that this is not going to be an easy thing. So in those situations, they should still isolate for 10 days past symptom onset or test positivity if they have no symptoms. And if they were exposed and under vaccinated, which we'll discuss in a minute, they should quarantine for 10 days. People who have moderate or severe illness, so anyone who had to be in the hospital for any length of time, should isolate for a full 10 days, and they might have to isolate longer, and that's really up to their healthcare provider. People who do not have a great immune system, they may shed virus longer than 10 days, so they should isolate at least 10 days, may need to isolate longer, and that's up to their healthcare provider. So again, what evidence is this based on? Somebody may not have their phone or their computer muted, so if you could just check on that, I would appreciate it. Thanks. So very early evidence suggests that the median peak of contagiousness for Omicron is at 3 days, but there's evidence that the range is 0 to 8 days. And actually, that's a typo. I need to fix that. It's not contagiousness. It's incubation. The incubation time is 3 days, and range of 0 to 8. I'm so sorry, that's a major typo. Delta, it was 4 days. So it seems that once you're exposed, your illness usually will start within 3 days, but again, it can be up to 8. So that was some of the rationale for shortening quarantine time. It seems to be most contagious from 2 days prior to symptom onset to 3 days after symptom onset. But really, there really is no good evidence for how long people are contagious with Omicron. Are they contagious shorter than that 10 to 14 day time frame that we know with the other variants? It does appear to be much more contagious than other variants. The estimates range from 2 to 5 times more contagious than Delta. It does seem to cause much higher viral loads in the upper airways. And so, as people cough, sneeze, breathe, there's just a lot more virus coming out of them. The one study that I could find that might give us some idea on time of contagiousness was just based on 11 cases in Japan. They looked at the amount of viral particles by PCR. So it's not really testing live virus, just PCR, so genetic material. Typically, in prior studies, and they comment on this in the paper, that the cycle threshold, which is how many times you have to replicate the genetic materials to find it, once you get past 35, so 35 here, so anything below here usually does not represent living virus. So anything above here typically does represent living virus, but that is not very reliable. So in these 11 cases, I'm so sorry, things got shifted on this. I had this red line nicely on day 5, but day 5 was here. So just illustrating that they found potentially living virus past day 5 in numerous samples. Again, does not mean that these guidelines are not going to work, does not mean you should not follow these guidelines, just an illustration that it is very likely people are still contagious past day 5. Therefore, the importance of consistent mask use when you're around people from days 6 through 10. So I tried to summarize the new guidance in sort of an easy way to follow. I know it is quite confusing and quite busy. Gosh, I'm sorry. So if you have symptoms of COVID or you test positive, so the CDC does state this, that even if you just have symptoms and you're not able to get tested or you're awaiting your test results, you need to isolate. So regardless of your vaccination status, you should stay home for at least 5 days if your illness is mild and you've not had a fever for at least 24 hours and your symptoms have improved. You can potentially leave the house after 5 days. You should properly wear a mask whenever you're around others for 10 days. You should stay home for at least 10 days if you're unable to wear a mask at all times, or you've had moderate to severe illness, which I mentioned is staying in the hospital, or you have a weak immune system. If you have symptoms of COVID, stay home. Yes. Again, if they're improving, you can leave after 5 days. If you are exposed to someone with COVID-19, you should quarantine. If you've not been recently vaccinated, not boosted, or unvaccinated. So if you're, and I have a table that kind of explains this here in a minute. If you're 18 or older and completed the primary series recommended for the vaccine and have not received a recommended booster, or you have not been vaccinated or not completed your primary series, you should stay home for 5 days. You should properly wear a mask for 10 days. You should stay home for 10 days if you're not able to wear a mask at all times. You should get tested as soon as possible and stay home if you have symptoms. And if you've not had symptoms, you should get tested on day 5 if possible. And then if you're 18 and older and you have gotten all your vaccine doses, including your booster, and if needed, more shots if you're immunocompromised. If you're 5 to 17 and gotten at least your primary series, they have not added in a booster requirement yet for this age group. Or if you've had a confirmed by a lab test, a confirmed case of COVID within the last 90 days, you don't have to stay home for 5 days. You should wear a mask for 10 days, and you should stay home and get tested right away if you have symptoms, and if possible, get tested after 5 days. So this just goes over a completed primary series is 2 doses of Pfizer, 2 doses of Moderna, or 1 of Janssen. And then that extra dose if you are immunocompromised, and then the booster doses are listed here. Again, right now, even though I'll go over this, but they just did approve boosters for younger age groups. They don't have to have had it with the younger age group to be counted as fully vaccinated or having the booster. I'm sorry, I know I'm really confusing things right now. Like I said, this has been really confusing for us too because of all the changes. But yes, ages 12 and above can get a booster, but as mentioned here, they just need to have the primary series to not have to vaccinate. So I will update this slide before we send it out. They also shortened the time frame in which you can get a booster for Pfizer down to 5 months. So that information is here. This just happened last night. So again, the rapid changes, but it is approved now that kids 12 to 17 can get a booster. They did shorten the interval down to 5 months for those who have had Pfizer, can get a booster after 5 months now, and that's just for Pfizer. And then kids that are 5 and up now that are moderately to severely immunocompromised can get that 3rd dose 28 days after their 2nd dose. Shifting gears a bit, we did get a question about MICR and if you can use MICR to look up student and staff vaccination status. As a reminder, there was a memo sent out, it was some time ago, and the link is here, but you can use it to look up immunization status of your students. You can use it for employees only if you have filed an amended agreement with MDHHS and you've gotten written consent from the employee and you were able to keep and retain those copies. And they did have an infographic kind of explaining that, which I put the link there for you. But the full details are in this memorandum, which again, the link is here. We've also heard from schools around the state really that they've been having issues getting their testing materials that they've ordered. The state has told us that you should email the state email testing address to follow up on that. We're also hearing though that you're not hearing back from that email. So if that's an issue, please forward that email chain to me or just a summary of, what school, when you made your orders, when you've emailed them, and you haven't heard back. And then I will forward that on to the contact at the state who said she would follow up on this lack of testing materials and the lack of follow-up. So just so you know if you're having that problem. So for your area's most up-to-date data, go to the mystartmap.info. I did not have time to pull the data for the 5 to 18-year-olds. I just didn't have time. I'm not sure how useful that is to all of you. If you find it hugely useful in your day-to-day or week-to-week decision-making of things, I will keep doing it, and you can put a comment in the chat if you do find it really useful. If not, it is a very time-consuming thing, and I won't do it if it's not useful. But again, if it is useful, I'm happy to keep doing it. I just did not have time this week with everything going on. So the information from the state modeling update, first, they did have just a review over this past year of 2021. On average, about 1 in 10 people in Michigan were infected with COVID last year. Just a little bit over that, about 1.3 in 10 people in the 30 to 39 age group were infected. More than 4.5 times the number of kids ages 0 to 9 were infected in 2021 compared to 2020. So that was the biggest increase for any age group between those 2 years. So as just an example or some kind of a visual, they mentioned that we had enough cases in 2021 to fill the U of M football stadium 8 times. Nearly 1 out of every 100 people in Michigan were hospitalized last year due to COVID. So that's a hospitalization every 7 minutes. And nearly 1 out of every 1,000 people in Michigan died last year due to COVID. So again, over 4.5 times more kids 0 to 19 years of age died last year than the year before. The absolute numbers of deaths were not terribly high, but still it's too many. More than 1 in every 180 people over 80 in Michigan died from COVID last year. So, I know I'll just leave it at that. So every county in Michigan continues to be at high transmission. The statewide positivity right now is 30%. So 1 out of every 3 person tested is positive. Last week, it was 1 out of 5. It's been increasing over the last few weeks. Our case rate is 785 cases per million. Not quite double from last week, but getting close. So very big increases over the last week, which is a very big sign that Omicron is well established in Michigan. We did see some decreases in school outbreaks, which likely is from the holiday break, but seeing lots of increases in our long-term care settings, so nursing homes and things like that. So these are our state numbers. So the top left is the positivity rate. So again, big increases. The daily case rate. The dark black line is the 7-day daily average. These gray bars, they're hashed right now because they're counted by date of onset of symptoms. So as new people test positive, those numbers tend to increase over time because they kind of retroactively get added. But these are the daily counts for those days. This would be December 27th, 28th. So you can see how much higher these daily counts have been just compared to a short time before. Hospitalizations are starting to increase a bit. Deaths are down, but again, these tend to lag behind by about a month because it takes a while for people to get sick enough to be hospitalized and then to die. For comparison, this is the United States. These are the last couple of spikes. So this one was just this last fall. This is where we are now in the US. So just exponential increases. This is Michigan again, just comparing our current wave to the past. Age groups, our young adults are leading in case rates right now. Our kids have pretty much dropped down in their counts in terms of who has the highest. So this is as of January 3rd. These dark purples are the counties that have had identified Omicron. In the country, 95% of the genotyping being done is Omicron. So it's essentially it's basically everything's Omicron at this point, with few exceptions. Down here, this is of all genotyping over, large amounts of time. So about 30% have been Omicron. I did get some data from one of our epidemiologists. The number of samples tested total are here from the 1 week between December 14th to 21st. That was 30% Omicron. And then just in the 4 days from the 17th to the 21st, those samples, 74% were Omicron. And it takes about 2 weeks for a sample to come back with results. So the suspicion is that we're probably close to 80 to 90% Omicron in the state. It's just that the results aren't back yet. So given the huge increases in positivity and case rates in the state, it's expected that pretty much everything is Omicron in Michigan now too. So breakthrough cases for the state. So about 14% of our cases are in people who are fully vaccinated. The definition of fully vaccinated is still just 2 doses, not the booster. I wanted to try to pull some of our own data, but I just did not have time. But we certainly are seeing more breakthroughs with Omicron. The booster is becoming more and more important. This, though, does help give you some more recent data. This is nationally, people that are fully vaccinated. Again, that's 2 doses. Are the blue line, the dark line are the unvaccinated cases. So some increase, but it correlates with the increase in the overall cases. And this is Michigan. So same thing. I want to make sure we leave lots of time for questions, so I'll try to go through this quickly. But basically, emergency room visits are increasing, hospitalizations are increasing, deaths are increasing, but of course, we're having increases in number of cases. The ICU rate has decreased, and so actually I misspoke, deaths are decreasing. So ICU rates and deaths are decreasing. So the hope is that even though we're having more and more people sick, it's hopefully less serious illness with Omicron. So again, visits for confirmed COVID take up almost 12% of all emergency room visits. Hospitalizations have spiked back up again. The ICU use for COVID illness, again, is down. That's all I had. I just want to minimize this here and maybe. All right, so I'll stop sharing and then I will get to the questions in the chat. If you have any questions, add them to the chat, and then at the end, we'll open it up to any questions on the phone. So one question was regarding those who have had a previous illness in the last 90 days, need to be lab confirmed. They were asking about the rapid testing in the schools with positive results are not okay for the 90 days. This has been a little point of confusion. The CDC states they must have a positive viral test. A positive viral test is either a rapid antigen test of any kind or a PCR test. The state of Michigan does not feel that an antigen test is sufficient. I feel, and so some of our nurses, of course, follow the state guidance. I personally feel that an antigen test of any kind or a PCR test is sufficient. So if any of our staff have followed the state standards of operation and told you that the school antigen test is not sufficient, they were doing the right thing and following the state standards of operation. But from this point forward, and if there's any issues or anything, you can follow up with me. But I feel that it is acceptable to follow the CDC guidance, and any positive antigen test or PCR test is acceptable. just basically no antibody test is what that's kind of getting at. And I am working on a more detailed, that graph I had or table I had that shows, you know, yes, you have to stay out 5 days, or you may have to stay out 10 days, that kind of thing, with definitions of what I mean by, you know, a viral test or different things like that, because I know this is extremely confusing. So when our waiver students who are not wearing masks all day are exposed, they have to quarantine for 10 days, or they can return to school in 5 days if they wear a mask for the next 5 days. Is this correct? Per the CDC right now, that is correct. Again, they have not given anything specific in how to actualize that. So again, I mean, do you need to do anything different for them when it's lunchtime or things like that? As a reminder, we do still have the test to stay guidance, which I am going to work on updating as well. But they can also stay with the test to stay guidance as that is written. So with changes in quarantine guidelines from CDC to 5 days, does that also include MIOSHA? So you'll need to, I do not at all claim to be a MIOSHA or OSHA expert. You will need to follow guidance from them. However, the Public Act 339, which I know we do get questions on, that defines isolation and quarantine both as basically, I don't know the exact verbiage, but following the CDC definition. So for that legislative act, if you follow what the CDC says, you're okay. With OSHA or MIOSHA, I haven't read what they have said lately or anything. I'm not an expert on that one. Do staff that test negative on a rapid test with symptoms still need to follow up with a PCR test? Are the rapid tests accurate for the Omicron variant? So there are some serious concerns, and this is a lot of the stuff that's really just developing now, and it's really hard to keep up with. But there are some serious concerns that with some of, if not all of the antigen tests, there may be less sensitivity with the antigen test, meaning they may be false negative, especially early on. So if you have people that are symptomatic and negative on an antigen test, it is safest to have them get a PCR test or wait 2 days and retest with an antigen test again. If we have cases over break, do we need to add those to our numbers, or do they count like cases in the summer when we are not in school? You can follow up with your county CD nurse to check, but I believe you report in your weekly report and any school cases, just those that have occurred during school days. None that would have happened in your students over the holiday, because those are not your responsibility, just those that happened on your watch, so to speak. Are you still considered a close contact if exposed to someone who is positive and wearing a mask? With the thought process being that now you can be positive. I know you're okay. So that's a good question. Let me just double check the definition of a close contact from the CDC. So in my opinion, I mean, they are still considered contagious for that 10 days. So, oh gosh, this is a tricky one. I would say, since the CDC is saying it's okay for them to be out, if the person who is infected and the person who is exposed are both properly wearing masks, then they're not considered a close contact. Because otherwise, everybody would be a close contact because they're letting everybody out in the public after 5 days. So if it's someone who's infected, leaves the house after 5 days and is properly wearing a mask, those around that person that are properly masked are not close contacts. With all of this, we're going to just have to do the best we can do, and it's going to be challenging. All right. So if both quarantine and isolation have decreased to 5 days, assuming they are healthy, if positive, they're able to return wearing a mask. So again, this is what the CDC is saying, and they are saying it applies to schools. However, they have given no further guidance on how to handle sports, how to handle meals, things like that. The state has asked that our schools wait for further guidance before following this, but we have all voiced opinions that it's really hard for you guys to wait. So again, per the CDC, you can follow this guidance for schools. It's just, we really don't know what to tell you right now regarding sports or lunches or things like that. And no, one question here is about testing before return. If there is no recommendation for a negative test before someone who is infected returns. One is because of that persistently positive issue. The other is just that there really are not enough tests right now for what we need them for. So it indicates the deaths of vaccinated and deaths of unvaccinated people is essentially the same. So
hey, Doc, I answered that in the comments. It was 85.5%
okay.
Of deaths were in unvaccinated between January 15th and December 3rd.
Yeah. So then only 15% were in those that were fully vaccinated. If the positive test was with us through test this day, is that sufficient? So I think I answered that already. So the new CDC guidance is what the school goes with, or are we going to stay on the 10-day until further guidance? Well, and one thing I want to mention, I guess I haven't mentioned this, you have every authority, regardless of what the CDC or the state comes out with. You can stay with the traditional guidance if you feel safer doing that. Because again, this is a way to get people back quicker. But again, they may be contagious still. So it kind of depends on what your comfort levels are. Those are still reasonable guidelines. I know I'll probably get questions from some of our ISDs who may have really immunocompromised students. And again, those are times where this would not potentially be a recommended option, because those are times when you'd want someone to stay home for the full 10 days. So they don't expect those or expose those individuals. So we are going to get more information from the CDC later this afternoon. We are supposed to get more updates from the state any second now. And anything new we learn, we will pass on to you. So your options are, and I hate to do this to you, but your options are, you can do what the CDC is saying as much as you know right now. Or if you want to wait until, let's say, Monday or Tuesday, and see what clarifications we can get from the CDC and the state as to what we're trying to make it basically nice standardized across the board. So what do you do in this situation or that situation? So if you wanted to say, we're staying with the current guidance until we get clarification, rather than making a change now and then a change in 2 days. I'm really going to leave it up to you. Again, I'm going to communicate with you as we get any clarifications. I just don't know if it'll be at 3:45 today or if it'll be, who knows? We know how this has gone. This has been one of the worst changes I think we've had all along, where it's just been really abrupt and no clarifications and a lot of confusion. And I really apologize. It's been very frustrating. So one question is, you know, if a student has had confirmed COVID in the last 90 days and then their parent is positive, can they come to school? Yes, because that's one of those situations where they don't need to quarantine, but they should wear a mask, and it is recommended they get tested after 5 days. So this is about a person who had COVID within 90 days and they have symptoms and test positive on an antigen test. Is it possible they're testing positive from when they had COVID the first time? Antigen tests typically would not stay positive from a prior infection. The PCR test is what can stay positive from prior infection. So the recommendation is that they be evaluated by a healthcare provider and be diagnosed appropriately by them, because that's a case-by-case situation. Our students who are right now either in isolation or quarantine for 10 days, should they continue to stay out for 10 days? Again, it's up to you. My suggestion would be, for the sake of avoiding confusion, is to not change your horses midstream and just stay with where things are at for now. But I think there's so much confusion, I would just do what is the least confusing for everybody. But again, hopefully I kind of explained that well enough just a minute ago. I know at least one person, I see a hand up, and I know at least one person said they'd ask their question live. So that was all the questions in the chat. So if you have a question you'd like to ask, go ahead and do so.
Dr. Morse, this is Justin Glusing, Superintendent at Crawford DeSable. Can you hear me okay?
Yep, I sure can.
So I was just wanted to clarify about, I know that the isolation and quarantine looks to try to get people back more quickly, but specific to individuals who are fully vaccinated but not boosted, am I remembering correctly that if they are close contact, even if they have no symptoms, they now have this 5-day quarantine minimum?
Yeah, and one thing I didn't put in that table, which I need to go back and alter, if they had their series within the past 6 months, so basically if they're not yet due for a booster, then they don't need to quarantine. If it's been over 6 months and they have not gotten a booster, yes, it is recommended that they quarantine for those 5 days. And that's for people who are 18 and older.
And
not. Yeah, go ahead.
Sorry, I'm just, my concern with that is relative to our staff. While I have a high number of staff fully vaccinated, I don't believe, and I don't have good records on this, but I would say 80+% of my staff are fully vaccinated, but I would say only a third of that group is probably boosted, even though they probably are all eligible for the booster. And this would add now 5 days of quarantine to that group because of the public act we need to follow that is current law. And I guess that's something I would just like you to reflect on. But then the other question I had is, I know we had some modified quarantine options for staff who were exposed at school to remain on duty if they remain asymptomatic and properly masked for 14 days and get a rapid antigen test for 7 days past the date of exposure. And I'm curious if there will be modifications to the modified quarantine.
So that modified quarantine for now still all applies. Again, I'm waiting to see what the state has to say, you know, what they're going to change, because we kind of talked about, you know, should it go to 7 days still, or can we shut it down to 5 days? So of note, there is one bullet point in the CDC guidance that says, if you are unable to quarantine, you should wear a well-fitting mask for 10 days when around others at home and in public. So that is there basically, again, trying to deal with those critical infrastructure people that don't have a choice. You know, I would not use that. The issue is that Omicron is so contagious, and we may have issues picking it up on the antigen test. So if you are absolutely out of teachers and you have someone who's had 2 doses but no booster and they've been exposed, they can technically work. And again, that's in a CDC recommendation, so you're okay per Public Act 339. They could work with a well-fitting mask. But again, that wouldn't be your primary means of staffing. That would be, you know, if you're in a staffing shortage, and that's why that's there. Does that make sense?
Yeah, it sounded good. I'd love to see that in writing so I could go back to it. Thank you.
Yep. Yeah, if you go, and I don't know if you know how to find this, but if you go to the CDC COVID page, Your Health tab under If You're Sick, there's the Quarantine and Isolation tab. And if you scroll down to what to do for quarantine, about midway down, there's a bullet point that says, if you are unable to quarantine, you should wear a well-fitted mask for 10 days when around others at home and in public. And then I got a question that says, if they do have a booster, how long after that dose would they not qualify for quarantining 5 days? That has not been set. I mean, right now it's just if they've had a booster. So, you know, time will tell how long that booster helps. Hopefully it helps hold our immunity for a long time. So current law isn't still local control. I don't quite understand the question, but the law I think they're talking about was a legislative act, which was Public Act 339, passed by our legislature. And there was an update done. It was December of 2020. So that's the law that applies to following or enforcing quarantine and isolation with your staff.
Okay, Dr. Morse, I'm the one who wrote that comment. So yes, the previous superintendent mentioned the current law. So that's, I was like, current law. Okay, so for our staff, there's a current public act, but for our students, it's still local control, correct?
Right, there's public health recommendations, and then school authority to enforce those recommendations.
Okay, so for our staff, we need to be following the Public Act 339, and then for our students, it's still school board decision and what they decide to implement.
Yeah.
Thank you for that clarification.
Yeah, no problem. Sorry. You say well-fitting mask, are cloth masks still appropriate for school? Yes. Yep. And so the CDC has, you know, definition of what is a well-fitting mask. Certainly, you know, if you have KN95 masks to offer your staff, you can. Those have not been proven to be safe or effective for kids. But as long as it's a 2 to 3 layer fabric mask, mainly just if it needs to be well fitting around the nose and the sides of the face, not having any big gaps in it, that kind of thing. Any other questions?
Yes, Dr. Morris.
Yeah.
Quick question on staff that work with students that have weakened immune systems, mainly center-based classrooms who have students with various disabilities. Most times they cannot wear masks no matter what their age is. The staff will be wearing masks, and we have several staff that are fully vaccinated, have their boosters, but knowing that those staff are still carriers of the virus, would it be recommended that if those staff have been exposed to the COVID virus, that they would not work with those students until that 5-day period, or would you recommend the 10-day period?
Well, the recommendation is that anyone who's infected or been exposed, avoid people who are immunocompromised or at high risk for severe disease until 10 days has passed. And it's recommended that people who are unable to wear a mask or those with a weakened immune system do not follow the shortened recommendations.
Okay.
So if you look at your population, it sounds like that fits the description of your population. Therefore, you should continue to follow the previous recommendations.
Okay. Thank you very much. Just wanted that confirmed. That was our thought. Just needed your confirmation to move forward.
And yep, and that information is in when I just explained where you could find the quarantine and isolation on the CDC webpage. There's a little plus sign next to it. If you click the plus sign below it, it says quarantine and isolation background. And if you click on that, that's where it gives you all the, but you shouldn't do this and you shouldn't do that kind of thing. So it's kind of hard to find stuff.
So then the next question to this, so we are at ISD, and obviously we have our behind the scenes staff, our business office, and I believe, I think you answered this yesterday, those that aren't working directly with students, they would be, probably could be categorized as the general public and come back after the 5 days as long as they're fully masked and all that precautionary stuff.
Yeah, I would say if they're not interacting with the staff or students at all, then they can follow the newer guidance.
Okay, and as long as they're not, don't have, aren't huffing all over the place, even within their mask, that would be. Okay.
Yeah.
Wonderful. Thank you so much, Dr. Morris. I appreciate all that you do.
Yeah. You too. Any other questions? So I'm gonna take a little time to make sure all my slides are correct. Like I said, I noticed some typos and it was a bit of effort to make sure everything was up to date, and I obviously missed some things. And I am working on some guides to help with those things, and hopefully we'll have some additional information by the end of today. We are working as quickly as we can to get you that information, but it obviously, it's hard to cram it all into one day. So in the meantime, if questions come up, just ask them. Don't hesitate, but we'll get things to you as quickly as we can. So likely you'll get today's slides and recording probably around Monday. Just again, I want to make sure all my slides are corrected. One last call for questions. All right. Again, I know this has probably been the worst couple of weeks, at least for us, the worst couple of weeks in terms of confusion and just horrific way of learning about new changes that are major. And we really apologize for how bad it's been. We wish it could have been better, but we'll just hang in there. And we'll talk next week, but let us know in the meantime if you have questions. Hang in there.